Welcome to Not Just a Dentist, the podcast where we look beyond the surface of dentistry and into the connection between oral health, whole body health, confidence, and longevity. I'm Rob Raimondi, prosthodontist and co-founder of One Manhattan Dental in New York City.
And I'm Dr. Mark Sclafani, also a prosthodontist and the other co-founder of One Manhattan Dental. In each episode, we'll bring more than 5 decades of combined experience to help you understand how great dentistry can support your health, longevity, and quality of life.
From full mouth reconstruction and cosmetic dentistry to prevention, technology, and oral systemic health, our goal is simple: to show why dentistry is never just about teeth.
Because this is not just a dentist. Great to be here with you. We have a few more topics from some of our patients that kind of support our talks and love what we're doing here. I get compliments every day on this. I love what you guys are doing together, giving us feedback and so forth. So I'm going to lead you into this. We call this topic the dental facelift. So let's describe what that is in relationship to a lot of people getting Botox these days to kind of fix their wrinkles in their face and try to make them look younger.
Fillers, Botox, red light therapy. People are doing a lot of things to work on the aesthetics or the health of their skin, right? And there's some impact to your face and the way it looks, and also systemically to your mouth, your throat, your breathing, your sleeping, to what's happening with your teeth. So as your teeth are aging beyond your chronological age, there's some impact aesthetically and health-wise, right? How many patients of yours will say to you they're doing Botox to deal with pain or aesthetic features because their muscles are developed too much?
Hear it all the time, right? They come in, they're facial spasms, and they're going to an oral surgeon or a dermatologist, and they get injected with Botox. It's maybe lasting them 6 months. It's getting them out of pain.
Right. The Botox is the Band-Aid, and the real problem's not being treated.
Correct. Now, there's patients that are doing Botox just for aesthetic reasons, right? Like you just mentioned, Botox, fillers, which is really addressing kind of like from the cheeks up. What it's not addressing is from the cheeks down, because most of this is a structural change. We call it VDO, vertical dimension of occlusion. What that concept is how the teeth come together. It's the measurement from the upper portion of the face to the lower portion of the face. Think of it from the tip of your nose to the bottom of your chin. As we age, if we're missing teeth that aren't replaced, as our teeth wear down from grinding, that dimension decreases. If you ever seen someone with no teeth in their mouth, right, that space is so small, right? Their lips are shrink, they stop not seeing their lips, and that's not being addressed. So you can do all the Botox fillers you want in the cheeks. It's not really restoring the structural damage that's taken place through the years from grinding, clenching, missing teeth, not replacing teeth. That's where we step in.
What happens is, let's say you lose a tooth or two in one part of your mouth. The opposing teeth can erupt up. So your mouth can dynamically change. But what Mark is talking about is if you happen to wear your teeth at a faster rate than which your teeth can compensate for, your lower jaw starts to collapse against your face.
Correct.
Acid habits, people grinding their teeth at night or during the day, have sleep issues. You're grinding your teeth faster than your teeth can super erupt into the space. So you're losing the dimension of vertical that exist. And the impact of that on the outside of your face is aesthetic issues, right? You're collapsing your face, condensing, causing wrinkles, that now people start to do the Band-Aid, get fillers or get Botox to kind of change the shape of their face. In addition to that, in your mouth, you're losing volume, which can have a big impact on how much air you get through your mouth and nose, and can affect sleep and breathing.
It's directly related.
So we have these two effects, systemically and also aesthetically, which can affect somebody psychologically. So you have this profound effect in somebody from not addressing or not dealing with the tooth wear and grinding. So if it happens early and there's not a sleep issue, we're making night guards for people to protect the teeth. If it happens and we didn't get to that point, now is where we get to put on our prosthodontist hat and restore someone's vertical dimension to where it was, to increase the volume of space from their lower jaw to their skull, their head.
So it's twofold. It's helping them out by increasing the vertical back to where it originally, I don't want to say increasing the vertical, it's restoring the vertical to where it originally was. So by restoring the vertical, what you're saying is you're helping the system by increasing airflow. They're going to breathe better, they're going to clench less, they're going to grind less, but it's also a big aesthetic change that Botox and fillers is not filling that gap. You can go to all the plastic surgeons in the world. If you have substantial loss of vertical dimension, structural change in your face, you're not going to make that up with fillers and Botox. I had a patient yesterday who was 53 years old. He went to an oral surgeon in Albany 10 years ago. He had these maxillary tori, and they told him to take out all his teeth. And they planed the bone to a point now he doesn't have any implants. They made him a denture, which he has not worn. To compensate for this, he grew a full beard and a full mustache, not to show his face, to hide his lip, because his lip was shrunken back. His cheeks were kind of hollowed in. And so now we have to start with a complete denture, make him a new denture, put him at the right vertical where his cheeks were, where his muscles were, and then go ahead and hopefully restore him with implants.
Yeah, we're not talking about people who just fall into a specific age group of females or whatever. We're talking about every gender, right? I'll never forget one of my first patients, Mark, who I treated, did like a full mouth rehabilitation on during my residency program, was this Vietnam vet, this Irish guy who's scruffy, and you would never think he cared about his appearance. But after I finished his treatment, and he owned this huge construction company, he said to me, my partner asked me if I got a facelift. What do you mean, Kevin? He goes, my partner in my business, he said to me, he said, you look great. You look so much younger. You know, this is a guy who was like a construction guy. You know, you wouldn't think of aesthetics, but he was so thrilled that his partner told him he looked younger, and because he didn't know it was his teeth. He didn't know it was his teeth, but his teeth made, and Kevin's this great guy.
That's the best part about it.
Rough around the edges, Vietnam veteran who rejoiced that he looked better, that his teeth made his whole face and his appearance, and he felt more confident.
And it wasn't noticeable.
And it wasn't noticeable.
Didn't know what he did. Didn't know why he did it.
So I think that for people who may not realize that addressing the issues in your mouth can really have a profound effect in not just your health, but also your emotional health, on how you feel about yourself. And that can then make you healthier, right? The amount of chemicals that get released every time you smile and you feel better can make you healthier.
Now with, if you look, there's a lot of research coming from the American Academy of Prosthodontists that some of the scanners that we're using will actually record where the vertical dimension is and where it really should be. So we can go ahead and then provide a mock-up to try in the patient's mouth to test the vertical dimension before we actually restore this. You know, this is part of our prosthodontic training where hard for a general dentist who hasn't been properly trained to accomplish this, to see this through. I mean, there are some general dentists that have taken extra courses and really understand this well, but that's probably the primary part of our training, I think, when we first learned how to do full mouth rehabilitation, whether it was from starting with a single crown for implants or just a simple denture, is to get the vertical dimension back where they originally were, to restore that.
Look, with this new patient of yours that you're seeing, you're going to start with his two front teeth where they belong.
Exactly.
Then you'll establish his vertical dimension, and you're going to do that kind of in an old school way.
Yep.
With wax and
wax.
And model work and a very traditional method. Once you get that established and you test that out, you will then digitize the entire treatment. You will show the surgeon where the teeth need to be. The surgeon will take his CAT scan and our digital planning and intertwine where the implants can go, and we'll see if it could be a successful transition to an implant treatment.
You know, after 30 years of doing this, the computers and the scanners have helped us, but the core principles remain the same. Yeah. Like you just said, we go back to wax sometimes just to try teeth in with wax to really set up the occlusion, the bite where it should be.
Yeah, so like just wrapping this up, that we can use the foundational principles of dentistry with the aesthetics of somebody's mouth and face and their health to tie all together to improve someone's well-being in this very systemic manner. So talk with your dentist. If we're your dentist, talk with us. If you think you have this issue, and we can try to see what the right solution is if you need anything.
Yeah, I like how you started by saying that Botox is just a Band-Aid. And once the teeth are in the right position, sure, the Botox could definitely help you with some cosmetic changes and get rid of some wrinkles. But without the teeth in the right place, the Botox is just a Band-Aid.
And Botox is a good Band-Aid for until you can get to the right solution.
Well, especially if you're using it for muscle tension and so forth.
Right. It can get you. It could be a bridge to get you through the process. So on the same topic, I more than ever, Mark, I feel like, I don't know if it's more of a known thing, if social media is contributing to it. I have so many patients every day talking to me about tension, about jaw pain, and trying to figure out what to do about it. I don't know if it's technology, that they're on their computers more, or they're more aware of it, but it's a conversation I'm having more than I ever have in my career.
Seen it more than ever now, right? Yeah, so true, so true.
Right? People are bringing it up more. In the hygiene room, in our own treatment, people are coming in for consults on a regular basis.
What do you think it is? You think there's more stress in the world, or we're diagnosing it better? Combination of both, maybe.
I think it's probably a little bit of everything.
Well, just like the airway, right? It's people have always had compromised airway and sleep apnea, but it's never been diagnosed to the level it's being diagnosed now.
Right. And I think that people have treated it, we as a profession have treated it incorrectly also. So now we have an opportunity to look at what's causing it, right? Is it a system that they're having where they're grinding and taking out stress on their teeth, or is it they're trying to breathe? And try and diagnose that the right way. And then what happens to their neck, their muscles. I have patients who are in physical therapy and acupuncture around their grinding and their tension in their
Shoulders,
upper body.
neck, it's everything.
So what's the first thing you recommend to a patient when they come in? Because we get this, a patient calls us for a new patient consult and they come in, they want their TMJ evaluated, or they think they're grinding, clenching. What do you ask them? What do you look for?
First, we're going to evaluate them, right? And see if there's any wear of the dentition from grinding or clenching. I usually lead and say, how are you sleeping at night? Right. And I start with the sleep. And I say 50% of them will say they're waking up a lot at night. And when they're going that route, maybe we're going to consider a sleep study. Some of them will say, I sleep great. So what is it? What's causing the grinding or the clenching, right? And then we kind of would lead into maybe making a mouth guard of some type of, whether it's covering the upper teeth, the lower teeth, or both. But even this, with some people, is just a Band-Aid because of the wear on their teeth, that the damage has already been done. That's adding to the grinding and the clenching.
Almost a quarter of the population right now is grinding or having sleep issues.
Yeah.
So we like to start the conversation is, do you have a sleep tracker of some sort? You're wearing an Oura Ring right now. We didn't compare our 8 Sleep data yet from last night. Mark and I both use an 8 Sleep mattress pad, which is the best, right? We love 8 Sleep. And so we first start with, what is your sleep tracker showing you if you have one? Or if you do not, would you like to get one? Then we go to the next level of a home sleep study and stress in their life, and also tooth wear. We're trying to see, is there a history of tooth grinding, tooth wear, or an issue with sleep? I feel like so many people report they don't sleep well when I then ask that question. And so you start doing a deep dive in your sleep hygiene and what you're doing from the moment, what time you're eating dinner, and what you're doing from the time you eat dinner to the time you go to sleep, to affecting your kind of sleep hygiene. And then also diving back to the morning, what time you're having caffeine until. And so we start the conversation with these patients who are having tech neck or muscle pain, grinding. Let's start with sleep. And then they might report, I sleep fine, but I'm stressed out, I'm grinding. Then we could then build on, if you can get sleep pretty efficient, are you exercising? And then what's your hygiene around your diet? So if we can then kind of optimize those 3 things, optimizing the wrong word, but try to get them to be at a good place.
It's just not one factor. It starts with the sleep. The sleep is affected by how much caffeine you had in the day.
I mean, if you're willing to spend thousands of dollars or hundreds on Botox on a regular basis because you're grinding too much and you're looking at different interventions, let's start about the foundation of your daily habits that impact your overall health and the health here, right? Because these things, like you said, are Band-Aids, not really treating the issue. Night guards are great for people who have a grinding issue without sleep issues. It can help to reduce tension in your jaw and the muscles and help to protect your teeth.
Yeah, and this is not always happening at night. There's plenty of people that are at their desk and they're clenching and they're grinding while they're working all day. A weight bruxism. So there's stress in the system that's affecting their grinding, and could it be related to not having a good night's sleep before that? Or it could just be different proprioceptives, neurotransmitters that are making them grind during the day.
Right, the hormones that release through your body for stress can affect your sleep, or can add to a sleep disorder, and or separately can make you grind at night. So it's a little hard to figure out what the cause is up front.
What came first? Yeah, what's causing
Right, what's causing it? How do we treat it? So getting to the issue and treating it properly can have a huge effect on the health of your body and also protect your teeth.
I think where we've changed in the past, people come in, I'm grinding or clenching, we would immediately go and make them a mouth guard. And that's not really the quick fix anymore. Because if you do have sleeping disorder issues and you just make them a conventional mouth guard, the jaw is still going to recline backwards. It's going to close the airway even more, and it can make the sleeping even worse. So yes, the plastic is keeping your teeth from wearing down, but it's not fixing the root of the problem of why they're grinding and clenching in the first place.
I like how you did that. The root of the problem, like a dental pun. I get it.
It's almost like it's another Band-Aid. The mouth guard could be just another Band-Aid if you're not fixing the problem.
You and I talk about this also with our patients, is if you share your bed with a partner, see what they're doing. Check on your partner. See how if they have breathing issues, right? We have people come in, oh, my wife snores, my husband snores, or they never sleep, but they keep me up, and try to figure that out together and look at the 2 different, like what's causing it and what are the 2 different options of treating it.
That's what's good that you mentioned the 8 Sleep, because you can judge your side of the bed and your partner's side of the bed also. wake up how you slept and how your partner slept. Yeah, I think the more markers, the more you could test, whether it's an Oura ring, like you said, whether it's a bracelet. If it's more advanced, then you're going for a professional sleep study. But if you're not sure and you're thinking you're sleeping well at night, you're not sure, I think some of these devices are very helpful just to kind of get you.
And now for a sleep study, we have at-home rings that you can wear. There's some things around that you need to have some hygiene around what you're doing, what you're not doing around that. You wear it for several days. They are medical data where the Oura Ring does not. So it's similar in a sense, but it's tracking a little more information that gives us more medical information to see how you're performing. And it's incredible, right? There's some medical groups that we work with that are testing every patient. And it's amazing how many people you find have mild or moderate. One of the doctors here, Anthony, just did a home sleep study. He's testing out a device and it diagnosed him with mild sleep apnea. He also has a baby, like a newborn and all these things. So who knows? It did say his mild sleep apnea.
You started to mention there's a lot of concierge doctors. You formed us a relationship with Atria, with Dr. Mark Benton, and they're testing their patients all for sleep studies. And they're coming up with a different type of monitor device for the sleep study. So these patients are coming to us and they're already diagnosed with this, which is very helpful.
That's why I think it's important to track your sleep some way, whether you wear an Oura Ring, a Whoop, an 8Sleep, something. I can't wear an Oura Ring every night. I put too much pressure on myself. It's a funny thing. Like I put too much pressure on myself to optimize my sleep. So if I wear an Oura Ring every night, I'll cause myself stress. If I do, it's just me. It's just
I can go either way on that.
You know how I'm intense about things. So,
but you're not being intense if you're not measuring it.
Well, no,
you're giving yourself a little slack.
Well, it takes the edge off. No, I mean, I still care about it. And I still have hygiene around that. I do think if you're one of these people, like wear it sometimes. Wear it for a week.
I still like to know what I'm doing 24/7. I'll take the edge off on the weekends when I know I'm getting less sleep maybe and not judge myself on the weekends as much. But I like to know how prepared I am in the morning when I come in and feel good about yourself and you had a great night's sleep.
So I had a new patient this week who is a cardiologist. And he came in most caring about if he had any inflammation in his mouth at all and wanted it 100% resolved and wanted any intervention possible to prevent any inflammation in his mouth. And so something we're talking a lot more with our patients about, and patients are talking with us about, is their gum disease, what's present in their mouth, inflammation, and how it's affecting their health, right? There's more news coming out that we've known about and talking to our patients a long time about, but it's now in the mainstream. And I mean, I have friends texting me articles about the bacteria in your mouth and inflammation can have an impact in dementia, heart disease, metabolic disease, Alzheimer's. And so gum disease can be a byproduct of your ability to clean your teeth, how good of a job your hygiene team is doing, and also your predisposition to inflammatory disease or gum disease. So working with you and understanding what it is, one of the problems we have is when we get a new patient and they've loved their hygienist for years, but they're having inadequate cleanings, right? So this cardiologist that we had as a new patient was doing a pretty good job keeping up with his appointments and seeing a hygienist, and yet they weren't doing a great job. On his x-rays, we can see a ton of subgingival calculus, which means buildup underneath the gum tissue that is not necessarily visible. He's unable to remove it. Only a hygienist can remove that. You can detect it with radiographs or by a proper exam. So I think what we want people to know is that you need to get the right cleanings at the right interval with the right hygienist and the right team, and you need to do a great job also.
Yeah, so gum disease is just not lack of cleaning your teeth, right? Periodontitis is one of the most consequential chronic inflammation diseases in medicine. We see most of our patients twice a year. Some come in 3 times a year, sometimes 4 times a year. They're being cleaned, they're flossing, they're brushing every day, and there's still inflammation in their body. And that just goes to show that there's a direct correlation that we find with cardiovascular disease and periodontal disease. Even if you're most meticulous about your cleaning, we'll still sometimes see inflammation in the body.
I would make sure that you're going for your annual physical, and when you do that your doctor is testing for inflammatory markers.
Yeah.
And if you have heightened inflammatory markers, looking at what you can do. It's funny, he said that when they find that a high-risk cardiovascular patient has inflammatory markers raised, his cardiologist, he goes, I make sure that they are getting cleanings every 3 to 4 months, no matter what.
So we're seeing them 3-4 times a year. At most, some people are only seeing their cardiologist once a year. So, we're the first line of defense to catch this. Like you said, the cardiologist is telling the patient, hey, you should see your dentist. But on the other hand, we should be telling the patient, do you have a good cardiologist? Do you see a cardiologist once a year? Because when there's traces of periodontal disease and inflammation in the mouth, most likely they have it in their heart also.
Yeah, it's funny. He actually brought up the bacteria. He goes, do you guys do salivary tests for P. gingivalis? Or of course we can. And of course we do on some of our patients. And there's some recent literature coming out about how P. gingivalis can spread through your body, can affect your immune system, affect, again, the tissues in your brain, your heart. And people who have heart disease and Alzheimer's found to have this bacteria in their actual tissues. So having the proper interval of cleanings and you doing the right home care can really help to lessen the load of this antagonist bacteria in your mouth and pathogens that can cause diseases, not just in your mouth, but through your body. There's a huge link to that. And so one of the exciting things that people are getting more aware of this. And again, it's about having a conversation with your healthcare team, ensuring that you have a hygienist and a dentist that is looking for the right things, making sure, point out where you have inflammation. Look, we have a lot of conversation with patients who push back on radiographs and some don't care at all. So what you can do is take radiographs at regular intervals and ask, I think what's more important is ask your hygiene team or your dentist to go through your x-rays with you and show me the bone height and the architecture of the bone. Is the bone perpendicular to your teeth or is it angled? Diseased tissues starts to be angled and vertical defects, where in a healthy mouth, the bone height will be horizontal and perpendicular to your teeth. Ask to show them the enamel, the thickness of your enamel. Do you have decay anywhere? What does decay look like? What does calculus look like? I think you care about your health more than anyone else if you were the patient. And you asking questions about how's my gum health, what would contribute bad, what would bad gum health look like? Do I have appropriate bone support for my age? Where would you rank me and my health and where I am, and how can I make sure that I'm staying as high as I can in the ranking?
Ask better questions.
Yeah, ask better questions, ask more questions, be more informed, and see how, like, our hygienists get so excited, and I get excited when my patients start asking me, like, if you ask me to show you your x-rays and teach you, it's like the best. It's the patient.
They get very excited when a patient comes in and there's no inflammation. On the contrary, when a patient comes in and they're here every 3 months and there's so much inflammation, they get upset about that. So it's not just about the dirty teeth. The bacteria is already in the gums, right? It's the body's immune response to that bacteria.
I would really just encourage you to ask your people and ask them what's going on. See how your healthcare professional answers the questions. You can learn a lot about the people who give you care by the way they answer the questions, how interested they are, and how passionate they might be, and how smart they are, informed they are about these things.
I think it's our job to get them interested, get them more informed.
Well, what I'm saying is, how do you ascertain the quality of your healthcare? If you're a patient and I'm worried about my gum disease, how do I know that I'm getting the right cleaning? Because this cardiologist, who is a very high level cardiologist, taking care of some of the most empowered patients, himself was getting inadequate cleanings. And he didn't know about it until we showed him. Emily sat down and showed him the x-rays that his previous dentist sent from having cleanings on a regular basis to the ones we took after the cleaning, to show him the difference and what was causing disease. He was like blown away. He's like, I can't believe they were missing this.
So the answer is you have to do whatever it takes. Some people need more education to, I don't want to say convince them, but just to re-educate them on how the body's breaking down and what are the consequences if this is going untreated. And I find most of our patients do respond well to that. There's some patients that just don't want to listen. They don't want to hear it. I'm going to come in every 6 months and that's it.
But that's the minority of our practice.
Minority.
Right?
The most of them are going to listen, and thank God we have a great team to support us.
Yeah, the other thing is, so Alzheimer's and heart disease, right? This is an easy thing to take your mouth off the table to contributing to it. The other thing that is a bit of a moving target is a female's hormonal situation throughout the month, in addition to pregnancy. So we want to make sure that everyone who gets pregnant gets their teeth cleaned in their second trimester, and then not too long after they give birth. It can cause more inflammation, more reactive inflammatory cells can spread throughout your body, affecting the baby. It also allows for these pathogens, the opportunistic pathogens, to infiltrate these pockets and then cause this whole cycle of inflammation due to the hormonal situation. Bacteria penetrates it, causing a secondary inflammation, then traveling through your body. So If you're pregnant, you want to make sure that you're working with your hygiene team to get cleanings. Yesterday, a patient was in, oh, my daughter's pregnant. Oh my God, what did she do? Let's make sure she comes in, because this patient I know actually has an inflammatory disease. So it's like, let's make sure we ensure the mouth is not contributing to any of it.
Yeah, I mean, I think the take on this is it's not, the conversation needs to change. It's not just about a gum disease, or if you're a great flosser, if you have chronic inflammation throughout your body, it's going to affect your heart. It's going to affect your brain. It's going to affect your sugar levels. And this accumulation of this over decades is going to affect everything in your body, as you showed, from Alzheimer's, cardiovascular disease, etc. So if your cardiologist is not noticing this about your inflammation, at least hopefully your dentist is, and there's a good relationship back and forth between the two of them.
That's a really good point. If you have cardiovascular disease, has your cardiologist spoken to you about your mouth health?
Right. I don't know. That's a good question.
We have
I
some
know the
cardiologists
that we're
do.
working are right.
Yeah. We have a practice getting referrals from a lot of cardiologists. Our practice has shifted. I think when I first started, we would get mostly referrals in terms of healthcare professionals from dentists. Now we get more referrals from physicians who are working with their patients on their overall health, and they're aware of the contribution of their mouth can affect their systemic inflammation, their systemic health, and diseases that we're trying to protect against.
Your dentist is seeing the patient a lot more than the physician or the cardiologist is. So the dentist has a greater responsibility about the systemic health.
All right. Well, please send us any questions or comments or topics that we can talk about moving forward. We're looking to start to do a couple of more of these live things where you can do a rapid fire question and answer. So the more you engage with us, the more we'll engage back.
Awesome.
Stay healthy, be well.
Be nice.